Provincial Command Council is led by Premier David Makhura, is looking at the province's fight against the COVID-19 pandemic. Makhura is currently on the podium. Let's go there now live.
It is comforting to see that as of this week, the recoveries in Gauteng province are now 70%, and the number of active cases are 29% of all the cases. The case fatality rate in our province continues to be at the level it was for a long time, just above 1%. And that's something that we are observing week by week. There are some weeks when we get more people who succumb to COVID-19. And we have gone through a very difficult period, particularly in the last 2 months. We have gone through a period where we have lost a lot of people on a daily basis succumbing to COVID-19. We also went through a difficult period where our hospitals, the hospital admissions were really bursting at the seams, and the situation is better now. We will get an update from Dr. Mdisani around this, about the situation with regard to hospital admissions. We will get that update in the course of the briefing today. Last week we had an opportunity to get the modeling team to talk about the hotspots, and they were able to indicate that even in our hotspots are running their course. The number of active cases in the hotspots is also going down. Of course, there are new hotspots, and I'm going to show it here. There are areas where we have new hotspots where the number of cases is going up. But when we have more hotspots running their course, the virus burning out, the number of people infected reaching the peak in a hotspot, and now we begin to have fewer and fewer infections, it's good. It's also a response to the work being done by teams on the ground, community health workers, activists in communities who are being sent with the health professional teams to those areas that are hotspots. So there is a positive story with regard to the recovery rate in Gauteng province. It is back at 70%. There's also a positive story with regard to the number of active cases. They are going down. There was a period in June, July when the number of active cases were back at 65%. Now the number of active cases are at 29%. And again, if you just look at a comparison, we always show you this graph that shows that during level 5, the number of cases we had, level 5 and level 4, the number of cases on average we had, the maximum number of cases would be 60 cases per day, and that was level 5, level 4. And then when we got to level 3, we started having an increase to above 100, to 200 a day, 300. And when we got to particularly June and the beginning of July, we got to the highest number of cases a day, above 6,000 cases a day. That's still a period that was difficult. And from there, the number of cases have been varying. First average 5,000 a day, and then you will see that our number of cases now are averaging at least 2,000 a day. And there is an issue that will be explained about the whether this has a relationship with the tests being done. Overall, our province, the daily infections are going down, and I will show in the next set of slides that also the hospital admissions are going down. Even elsewhere in the world and everywhere in the world, when you have the daily infections going up, you must be very, very concerned. The surge is happening. When you have increases in hospital admissions everywhere in the world, you must be very concerned, because increases in hospital admissions will lead to increases in ICU admissions and then lead to more people dying in that situation. That's as a consequence of that. So we share with you what the picture is per week. You would see, so this is week by week. The worst week we had with regard to the daily infection or weekly infection rate was when we had the average of 5,196 cases in a week. Now you would see that our average has dropped down to 1,765. The Minister of Health showed a different graph, but all these graphs are showing that there is indeed the surge is easing. We don't want to say as yet that we have passed the peak. It may have been a wave. It may have been the first wave of the peak. We are still working on the basis that we may still go through the toughest time of the storm. And we are still working on the basis that the worst is still to come. And this is the right message to send, because once we send a different message to say to people, oh, the situation is now okay, people who have been responding to the message of wearing masks, those who have been responding to the message that don't go out there in the public, do social distancing, no parties, no marches all over the place. This is a very important message we have been saying. These have been the funerals, again, the drivers of the daily increases in infections. So even as we see that there is some decline in the number of infections, we want to say that we still have to work very, very hard. And I know I get a briefing every day about the work being done in the sub-districts by our health workers who are targeting the areas which are the hotspots, including the work they have been doing in the last few days in some of the hotspots I'm going to show here. So what Dr. Mkhize was saying, that in the Western Cape, in the Eastern Cape, and in Gauteng, the number of cases per day are declining. That evidence is also showing that evidence in terms of what happens per week, the average number of cases per week. We are showing that there's ample evidence to demonstrate that. But we are saying this does not mean the worst is over. We must still prepare for what the modeling is saying will still happen during towards the end of August and in September in this regard. So the regional breakdown, we always give this regional breakdown. Johannesburg, so if Gauteng is the epicenter, Johannesburg is the epicenter in Gauteng. The number of confirmed cases in Johannesburg as of now is 76,297. The number of recoveries in Johannesburg is 59,779. And the number of active cases in Johannesburg is 15,548. And close to 1,000 people have succumbed to COVID-19. To be precise, 970. Followed by Ekurhuleni with 41,000 active cases, confirmed cases. and then Tshwane. The three in our province, so Johannesburg, Ekurhuleni and Tshwane, are high-density metros. In that regard, they always would naturally have more people in those areas. And then the two districts in our province, Sidibeng and the West Rand, in terms of the number of confirmed cases, the districts are more or less at the same level. There was a period where the West Rand was quite low and Sidibeng was quite low. At the moment, there are 12,000 each of them. They've evened out. And we know that in the West Rand, it was the mining areas that drove the infection. We will show you what's happening in that area there. Whereas in Sidibeng, it was the key townships that drove these increases in infections. The sub-district numbers, so if you ask the question, where do we have the largest confirmed cases in Gauteng province at the moment? It is a sub-district in Johannesburg, or a region in Johannesburg, that's Region D. Now, Region D is Soweto. It's the Soweto area. That's where I want to remind you that there was a period in June where the largest number of active cases and confirmed cases were in Mayfair, in the Mayfair inner city area. And then there was a period in May where in Johannesburg the largest number of active cases were in the Ivory Park Midrand area. In each of those cases, we went into those areas to do some work in those areas. And I'm very glad that there's been very systematic work by our community health workers, health professionals, and community activists in the Mayfair area. In this week, last week and this week, and they also went into the Orange Farm area. So when these numbers are where they are, I was told that they are now focusing on Soweto. When we say Soweto, it's at the moment the sub-district that has got the largest number of confirmed cases is Soweto. That's where we are going to direct lots of interventions in those areas, including law enforcement of funerals, ensure there are no parties, there are no public gatherings, but also mobilize communities in those areas to come to the party on the social measures, to also ensure the communities know their own areas, which sections of Soweto has got new cases. They need to know so that they can protect themselves. And then we are able to point out the sub-districts that have got the largest number of new cases in that way and follow them. So the highest confirmed and active cases in the sub-districts per week. So in this week, again, I just spoken about the slide that shows Soweto has got the largest number. So again, this is the slide that shows you that Soweto, which includes the different areas of Soweto combined, Dobsonville, Doornkop, Proteedland, those areas, that's where we have the largest number of confirmed cases in the province, followed by another area in Johannesburg, that is the inner city of Johannesburg and Mayfair. This is the area that used to be, there was a period, as I say, that it was really the largest, the area with the largest confirmed cases. It's still there, but there's interventions that are being done in that area. And then it's followed by the Alexandra, Wynberg, Sandton area, followed by an area in Tshwane, that is the Atteridgeville, Lodium, CBD area of Tshwane. So in Tshwane, at the moment, the area that has got the largest number of cases is the CBD, Pretoria North, Atteridgeville, Lodium area. And then followed again by Johannesburg, and you would see the number of sub-districts that have got the highest number of cases. In every region we do have one or two. And if you ask the interventions that we are making, the grassroots work, the focus and energies of our health workers, those who are not in the institutions, those who are not treating the sick in the hospitals, those who are on the ground in the district facilities, in the clinics, their work is directed by this data that says, in your area, we've got a problem, a big problem in this. Don't only sit in the institution, but go out there to help us attack the areas that are a big source of infections in Gauteng province. Again, we present the same information in a different way. I want to quickly, so this is the 7-day increase per district. This is information that is important for our communities. It's information that's important for those who are working on the ground. We're making this information available between last week and this week, where did the daily increases happen. The largest number of increases happened in different areas. We also share with you the gender breakdown of those who have succumbed to COVID-19. This is the information we share all the time. We indicate that 55% of those who have succumbed to COVID are males and 45% are female. And 65% are people above the age of 50, basically between 50 and 79. This is still the story that those who are at greatest risk are people above 50, and this is confirmed by the figures that are coming out. But we're also seeing that there are in other categories 11% of those who have succumbed are in the age 40 to 49, and the younger people who are in the age 33 to 39 is 5.4%. This information is important for epidemiologists and scientists to tell the story of who is most vulnerable, and that trend is continuing. But I must also indicate that from infection point of view, we have seen significant number of young people who have tested positive, and women, especially during June, July. A lot of younger people in the age 20 to 29 who have tested positive, and a lot of women who have tested positive in that period, especially between June and July. And answering the question, why would it be women, is something that our data scientists are still following up on. More analysis about fatalities. I will leave this one. The story of those with comorbidities is still an important story. That it is people who have other underlying diseases that are most vulnerable. Again, this is the story of COVID all over the world. It's confirmed here that the largest number of people would be 58% are people who either have diabetes or hypertension, and the rest it's other categories. Testing. The Gauteng province still has the largest number of tests. We have reached 1 million now. 34% of the number of tests conducted nationally are done in Gauteng. There was a period when it was 33%. There was also a period last week it was at 35%. So it's slightly lower. but it's still above the average of 33%. That has always been what we have done over time. I want to leave the scenarios they were presented. I just want to go and deal with the hospital admissions, and I said Dr. Mdisani will say something a little bit more about hospital admissions. You would know that there was a period when our hospital admissions were about 1,000, and in fact there was also there was a period where we had 7,000 hospital admissions in that period of June, July, so the hospital admissions are now at 4,688, almost close to equal in the public sector and in the private sector. We had a little bit more in the private sector, in the public sector now. We used to have more in the private sector. We have more in the public sector now. Those who are on ventilation is 316, and then others are on oxygen. You would see that the different categories of, and others are just, even if they are not in ICU, they are in general wards, and then the availability of oxygen is very important. And that's why all our facilities have, the general drive is to ensure that even in the field hospitals, the critical issue is to ensure that there will be oxygen available, so that people who would have difficulty with breathing will get assistance in that regard. So I will ask Dr. Mdisani to come and talk about the hospital admissions again. Just to give a picture, there was a question last week about what has happened with regard to when the suspension of the sale of alcohol happened, and what's the situation now. Dr. Mdisani will talk about that briefly. The number of public servants who have tested positive in our province, out of that 172,000, we have 5,242 who have tested positive. In the number of those who have recovered, we have a lot of our public servants who have recovered. But as we speak now, 5,242 public servants are COVID positive in Gauteng province. And in that category, we have had a lot of healthcare workers. The good news is that a lot of healthcare workers have recovered. There was a period in June when we had a real difficulty with too many. I know it even when in a few weeks ago when I was COVID positive. I know it. The health workers said there are many health workers. Some of them were said their facilities, their clinics were running at 50%. And I got a feedback again from them that a lot of those healthcare workers are back now, have recovered. So there was a period where the impact of COVID-19 on the healthcare workers, the frontline people who are the ones really in the forefront of this battle, were severely impacted. We have lost a lot of healthcare workers as well. But the good news is that a lot of them have recovered now, are back. And those we have lost, we have conveyed our condolences to their families. These are frontline soldiers, doctors, nurses, and various professionals who have succumbed to COVID. We say may their souls rest in peace. The PPE stock, we continue to, even as we deal with corruption that has been related to PPE and the investigations underway now, we don't want to run out of PPE. The critical thing would be to ensure that any new PPE supplied is done in accordance with the regulations. So in other words, what has happened, which I'm going to come back to what the consequences of that is, we don't want to happen. We do want to make sure that there is enough PPE as we're preparing for the peak, and it must be PPE of the right quality. That's something that we do want. We don't want a situation where the rogue and corrupt elements focuses us away from ensuring that there is enough stock for PPE, because our troops, the healthcare workers, are on the ground. They are fighting the battle. They need appropriate equipment. They have not stopped fighting the battle. They are there on the ground. They need PPE every day as they fight the battle. So as we deal with corruption, we must ensure they have PPE that has been procured properly and of the right quality. That's something that we want to continue to address. There will be the issue around food security, which will be addressed by the MEC for Social Development. I want to leave this one out. The schools, I want to leave the schools out for MEC Lesofie, who will have a bit of more to say about the schools. And I just want to, on my side, I want to conclude by doing an update on corruption investigations. I said last week, speaking here, that the damning allegations of corruption regarding the procurement of PPE in Gauteng province have profoundly eroded public confidence in the collective work of our provincial government, and in the work we have done so well in a sustained period in the fight against COVID-19. I didn't mince any word about this, that this has undermined, severely eroded the standing of our provincial government. I also made a commitment that we will get regular updates because I reported to you that we asked the SIU to look at this investigation at the end of May. We started this process at the end of May, and I said last week that I will continue every week to give you updates. Whenever we get some update from the SIU on the investigation, we will also be doing public updates around anything of significance. As you are aware, we said also that if in the course of the investigations, as they do their work, the Special Investigation Unit, if they identify an area of risk with a great deal of evidence where we must take action, I said last week we are going to take such action, including where they've been able to establish that certain things have gone wrong, including that cases will be opened immediately, so that we don't wait for the entire investigation to be completed and only to act after several months or weeks, depending on how long it takes. And in that case as well, that the SIU, in our discussion with the SIU, they also indicated that their mandate would be clear, that where they already establish criminal activity having taken place, matters will also be, as they continue investigating, they said matters will also be referred to the relevant authorities, law enforcement authorities in our system of government. The SIU may also recommend, which is something I said, where they've identified, as they do an investigation, they identify that things have happened that are wrong. They'll also recommend to us immediate action to be taken against those implicated. We know that the SIU is empowered to take steps also to deal with the issue of asset forfeiture and asset seizures, working with the other institutions, and immediate cancellation of contracts. They are empowered to do that. So as they do this work and they identify in this area there's already a case, we're not going to wait until the entire investigation is done. We will be acting as they undertake their work. So what is the update? Yesterday, we received an update from the Special Investigation Unit on their work regarding PPE procurement investigations in Gauteng. And I want to say that the SIU is making headways in this investigation concerning COVID-19 procurement in Gauteng. So with immediate effect, they have been able to identify that there is a need to open criminal cases, which they have done based on the evidence of the work they have done so far. That's why I'm saying the SIU investigation started at the end of May. So they have already identified that there are certain criminal activities that are worthy of opening cases about, and they in this PPE procurement, and that's their part that they are handling. The second thing is that they've also identified 2 officials in the Gauteng Department of Health who have allegedly enabled and facilitated this procurement corruption. So in the briefing that they gave us yesterday, firm briefing, they've identified that there are 2 officials who have been central to enabling this large-scale grant corruption. One of those officials is still in the system, and another had resigned. And I want to report this morning that the head of Department of Health this morning has taken action to immediately suspend the official who is still in the system. The head of Department of Health is here, Dr. Lukele. So this morning, as we speak this morning, the head of, because the briefing was yesterday by the SIU, and then the official who has resigned, the provincial government, together with the SIU, are pursuing legal and criminal case against that official. So this is the first set of action, preliminary set of action. We don't want to lose more money. We don't want more corruption to continue even after we have put in place an investigation. So whenever the SIU will come back to us and say there is another official in the course of the investigation that they have identified, there's the SIU is also following up on companies. So among some of these criminal cases, it's companies where they are convinced that there's a criminal case that that needs to be pursued against those. So this is the first set of action that is taking place on the basis of the briefing I gave last week. I also want to say that in the provincial government, we also have a disciplinary process that is underway regarding that e-gov, the irregular procurement in the Department of E-Government. The contract has already been cancelled, and the disciplinary process is underway against those officials who are responsible, identified by the investigation that those officials must be charged and must face a disciplinary process. So every week, we are going to be giving you an update every week. As the SIU investigation continues, we will be giving you an update every week. When we get an update ourselves that the next thing that has been identified is the following, take this course of action, we will be doing that, because it is about safeguarding the resources that are so crucial for this battle against COVID-19. And the SIU investigation is wide-ranging. It's not just about PPE. It is also about all other procurement that has to do with COVID-19. Every time something gets directed our way, the SIU investigations are also following up on those. And again, when they have been able to do work that will be able to bring to our attention that on this particular issue, we have identified what has gone wrong and who must be held accountable, take action, we will do that. So there are two sets of actions. The one is internal disciplinary processes. The other is in pursuing criminal charges against those responsible. And we are confident that we will be able to do this work. Let me just conclude on a matter pertaining to clean governance. Last week I said to you, the Gauteng Provincial Government for 6 years before this period had endeavored to put in place an open tender system that reduced the level of corruption and wasteful expenditure and irregular expenditure. That open tender system worked tremendously for us. The hyenas were at the door, the thieves were at the door. Once COVID-19 happened, the open tender system was not in play, was not being implemented. The hyenas attacked, and they brought great disrepute to our government. As part of the commitment to clean governance in Gauteng, I have also committed in my State of the Province address last year that we will do lifestyle audits for all members of the Executive Council. In other words, the Gauteng Provincial Cabinet, otherwise known as the Executive Council, myself and the 10 MECs. It took a while to implement this resolution because we were engaging different state institutions to say which one can be able to do that. I am glad to say to you, from next week, the State Security Agency will be doing lifestyle audits on me and the 10 MECs in the Gauteng Provincial Government. This is a resolution we took and announced at the beginning of this term. I finalized now with the State Security Agency that they are the relevant appropriate state institution with the capacity to do this. So from next week, we are hoping in 6 to 8 weeks they will be able to complete this work. In 6 to 8 weeks of lifestyle audits on the members of the Provincial Executive Council in Gauteng. That is the Premier and all the 10 MECs in the Gauteng Provincial Government. And as I say, part of fighting corruption is to ensure that there's definitely no conflict of corruption and there's no one who is actually living beyond their means. This now has been finalized. This work is starting next week. So at this point, I just want to, Emisili Sufi, I want you to be brief today on the update on education so that we can come back to one or two additional health issues, the hospitalization, and then the MEC for social development will just be brief on issues pertaining to food security so that we can take questions. MEC Lusufi.
Thank you.
The acting MEC for health has just been doing observations. The whole week he's been going to every institution, every place, every institution, every establishment, every facility in the province to go and make observations around what's happening there. And he says he will be able in the coming week to make proposals on how to strengthen the fight based on the feedback he has from institutions, from public health the public health managers on the ground, from the trade unions, on how to strengthen the fight against COVID. So he will not say anything today. He'll be able to say something next week after he spent a week engaging with managers and unions and verifying what's happening in the institutions. Ms. Lesufi, I'm giving you 10 minutes. Update on schools.
All right, breaking news on the Agenda's Watch. The SIU has identified 2 officials in the Gauteng Department of Health, allegedly enabling large-scale corruption with regards to PPE corruption. That's what was announced by the Premier there, David Makhura, giving us an update with regards to SIU investigations, saying that the SIU is making headway with regards to their investigations, identifying the need to open criminal cases. They have identified certain criminal activities. So also something very interesting that came out with regards to investigations. From next week, state security agencies will be doing lifestyle audits on the Gauteng Premier as well as the 10 MECs in the Gauteng Provincial Government. Breaking news on the Agenda's Watch. SIU identifying 2 officials in the Gauteng Department of Health that allegedly enable large-scale corruption. I understand that Panyaza Lesufi is currently talking. Let's go there. We were going to go to Port Elizabeth to get an update of a developing story there, but let's go now back to Panyaza Lesufi and listen in.
Schools took a break, and on Monday we took the first team that came back, and we'll give you details of the number of learners that came back. We are preparing to bring back the grade 7s next week. We'll also give you the preparations towards that activity, and we've received lots and lots of applications from educators who indicate that they've got limitations of coming back to teach, and therefore they're requesting permission to work from home. We'll share those details with you so that we have an idea. Of all the schools that have grade 12s, can it be flighted, if I'm not mistaken? Tabu? It's not yet? Sorry about that. Very sorry about that. We just trying to get the presentation so that everyone can follow. But I'll continue. I think people get it when when it's connected. Of all our schools that have grade 12 as a grade, 85% of our schools received learners back. It's only 15% of our schools that couldn't open, purely because they have to close to decontaminate, or they have acts of vandalism in their school premises or break-ins, and this caused the schools not to open. That is all our public institutions. In terms of our special schools, that is Elson schools, we only had 2 schools that could not open, purely on the basis that they identified cases of COVID and therefore could not open. So we are pleased to where we are, that the schools that have grade 12 managed to reopen, and only schools that don't have grade 12, but we are still preparing them to come back on Monday. And I think this will give us an idea of where we are. Of the schools that could not open, there are 18, purely on the basis of, as I said, COVID cases, and only 5 schools that could not open on the basis of infrastructure vandalism or break-ins, and 8 other schools could not open because there were disruptions by either student body formations or parents formation that still insist that schools must not open until we have gone through the wave. Thank you so much for the loading of the presentation. I can control it from here now. Thank you. So I want to give the exact figures of the schools that opened so that people can have an idea. We had 598 schools that have grade 12 that opened, and only 24 schools that have grade 12 that couldn't open. In total of 622 schools in our province. So this is very important because it gives an indication whether our school environment is safe, whether schools are operational in our province, and we can quite declare that our schools are operational. I've taken you through why the schools could not open. 5 of them is due to infrastructure-related problems, and 18 was because of COVID-related cases, and 8 was mainly because of disruptions, either by learner formation or parents formation or other formations that believes that school should remain closed. In terms of attendance, we're giving you a 3-day collection of attendance in terms of learners. We are quite pleased that the numbers are increasing. We started at 56% on Monday, which was worrisome. It increased to 72% on Tuesday. By Wednesday, we're at 76%. We are still worried about those that are not reporting for school, and we are putting measures to ensure that either they register to learn online or they participate on our lockdown education so that they can be in a position to catch up. In terms of educator attendance, on Monday we started with 65%, it increased to 73% on Tuesday, and by Wednesday we're at 78%. This is the number of educators that are available, and we want to thank those educators because it's very, very important. The education system works around educators. Without educators, we don't have the education system. So the 78% that have reported for duty, we also want to thank them for that. So you can see averagely, in terms of schools that had lower attendance, with 125 schools that had lower attendance, it reduced to 117 on Tuesday, and it went down to 78. And we are working very hard also with those schools to ensure that everyone can come back to school. This slide indicates the number of positive cases that have been reported to us in our schools as at the 5th of August. We're also keeping these statistics because they're very, very important, just to determine whether we are pushing back the virus within the schooling environment or not. Of all the schools, of the 2,088 schools that we have in the province, 18 of our schools have to close purely because they reported cases of COVID and they have to shut down. These are the schools that, as I'm speaking to you now, they are closed on the basis that they are waiting to get people that will decontaminate the school, clean the school, and immediately after cleaning our schools, will be in a position to reopen. So 18 of our schools, as I'm speaking to you now, are closed. The numbers might be low purely because we only have grade 12 schools. They will start to rise when we bring grade 12. So in total, if you add these 18 schools, in total thus far, we've got 2,099 schools that had cases of COVID, generally, including our institutions. Of that, 714 learners tested positive, and 1,671 educators tested positive. In terms of the support staff, 165 of our support staff tested positive, and 68 of our general assistant staff tested positive, whereas 20 of our youth brigade members tested positive. So within the entire schooling environment, 2,635 COVID-related cases were reported in our schools. The next slide gives us an idea of the capacity of our educators. How many educators we have, how many educators are ready to leave the workforce because they can't cope, and how many educators will we need to replace. So thus far, we've received applications from 3,699 educators that are above the age of 60 that have indicated that they want to leave the profession. Of the 3,699 educators, 2,117 are teaching at primary schools, whereas 1,193 are teaching at secondary school, and 389 are teaching at special schools. Of these applications, we've managed to ensure that we approve 2,631 and we've declined 200, which simply means we need 6,747 young new teachers to come and replace the educators that are leaving the profession. The 6,747 will replace those that are above the age of 60, that is 3,699, and those that have comorbidities that believe that they can't work from our school premises. So that's the effect of what we need. That is why we'll always appreciate those educators that are reporting for duty daily. This is a very important slide that we monitor, because you will see from this that our human capital budget will start to hot up on the basis that we need to recruit as many educators as possible. We are pleased that the National Department of Education has started the process of creating a database to recruit young people, and we tap on that database so that we can get as many young people as possible to come to our schools. In terms of infrastructure, unfortunately, we still have 353 schools that have been affected by vandalism. As you are quite aware, every time we close schools, we know we'll have cases of break-ins. So during this period where we closed schools, 8 of our schools were broken into, and this affected the reopening of some of those particular schools. Thus far, 351 schools, we have appointed service providers to go and repair those particular schools, and we are pleased that they've made huge progress. In terms of school nutrition, we are doing very well. Between the period that we closed, we had 166,000 learners that received school nutrition. Unfortunately, there were challenges on the basis that we don't know how many learners are coming, because we're implementing a court case that compels us to provide school nutrition even during school holidays. But we are doing very well.
All right, there you go. The Education MEC, Panyaza Lesufi, giving us an update with regards to the situation in schools around Gauteng, talking about, well, outlining why certain schools are open and why certain schools are closed in terms of infrastructure, etc., etc. Giving us some interesting numbers with regards to some of the positive cases. Out of 2,099 schools, 2,099 schools had cases of COVID. Over 700 learners have tested positive so far. Over 1,000 educators have tested positive so far. So I will come back and give you a wrap of what the Gauteng Premier had to say with regards to the numbers in Gauteng, but basically Gauteng, the epicenter in South Africa, Johannesburg, the epicenter in Gauteng. These are live visuals. This is from KwaZulu-Natal. Health Minister Dr. Zweli Mkhize spending 2 days in that province, which is expected to reach